Hey guys, welcome in. We are a few minutes early. You're off tonight. Awesome, Nuria. I mean, Magda. So welcome in, you guys. We are logging on a little bit early so that we have plenty of time to get everybody tagged and in the right place. But welcome in. So I was just asking these guys on Zoom with me what everybody's doing. So it looks like we have people that are off tonight. That is very exciting. I know a lot of you guys are on the East Coast, so you'd definitely be off. And I appreciate you hanging with me on a Friday night for night 5 of the 5-day KG challenge. So I'm really excited tonight because this is my favorite case of the whole challenge. Yes, this is my favorite case. I think it's the most important case. It's probably what I'm most passionate about. I know you guys probably think I'm most passionate about WPW, but I'm not. I'm actually most passionate about the non-specific ST2 wave changes. So welcome in. And yes, as Tori said, say hi. When you guys log on, say hi to us, and we can say hi back. So put hashtag replay if you're watching the replay, hashtag live if you're live. And just so you guys know, we do have replays available, and we have them available in the guides section at the top of the group. But we also have them, hey Esprit, we also have them in a nice handy replay link that Ruben has put together for us. So if you missed any of the sessions and you're like, Jen, the weekend's coming up, I'm gonna be watching some sessions, can you make it easy for me? Yes, I can. I'll give you the replay link. It's super easy and you can watch everything on one page. So welcome in, Sophia. I can see that you just joined us live, and let me see if, who else is with us? We have Lori. Hello, Lori. Welcome in. And awesome. Okay, so I'm actually stalling a little bit because I know it's not right on time, but a couple other things. If you still are new to us and you need the workbook, let us know. We'll send it off to you. The workbook is great because you can actually work through the cases with us, and you can actually mark on the EKGs, which I like so much. Also, a note about this weekend. So 2 notes, actually. A lot of you guys have been messaging me and asking how long the sessions are going to be up. So they're going to be up for at least a week. Okay, that I know for sure. So you guys will have access to them for at least a week. So I recommend getting caught up this weekend if you can. We try to make everything really super snack size, easy to digest, and that's super exciting. Also, I'll be talking about the CE in just a minute, how to get CE if you are an RN or PA or NP or EMS. We have CE available for you guys. Okay, so don't hesitate to reach out and ask for it. It's 2.5 hours, and it's all based on what we talked about this week. Okay, so including tonight, of course. Oh, and last but not least, I just wanted to remind you that this weekend we will be having a bonus session. Hi, Mariah, welcome in. Thank you for saying hi. It always makes it so much more fun to interact with you guys. So I love that. You can see Esprit here. Yay, Esprit. So we are going to have a bonus session this weekend, and it's going to be on Sunday at, I believe it's 5 o'clock PST, I believe. And that's going to be a couple extra cases. So tonight will not be our last official night. We will have a little bonus snack on the weekend. And yay, Michelle's here. So I have to make sure to get Michelle up on here with us, because as you met Michelle earlier in the week, I think it was 2 days ago, Michelle actually did the games for us. And she's also one of our coaches in the 30-day EKG challenge. A couple of you folks won tutoring with Michelle, so I know she's already got you situated with your tutoring for this weekend. And just a little note, if you're going to be staying tonight for tonight's prize, yay, we are going to be giving away some tutoring sessions with me. Yes, that's going to be our prize tonight. So make sure to stick around. Tonight's session is not very long. Hi, Jen. And Esprit loves the games. I know, because Michelle just makes everything so much more fun, you guys. That's one of the many reasons we love having her in the 30-day EKG challenge. Okay, one other thing is somebody messaged me earlier in the week and said, hey, what I need is actually a little bit more basic than what you guys are doing. And I so respected her for saying that. She was like, I just need a little more basic, and that's totally fine, right? There's no way we could actually have a challenge that's the perfect level for everybody. All right, we have lots of beginners, we have lots of students, we have lots of in the middle people, right? Very few experts, what we do. So if that's you, right, I want you just to understand, oh, I know, thank you, Asprey, they are in for a treat. We're going to be selecting a few people to come behind the scenes with me, one-on-one, not one-on-one, but face-to-face in a Zoom this weekend, okay? So I just wanted you to understand that what we do in this challenge is designed to make you feel like you get a little traction, like you're like, okay, yeah, I kind of see where you're heading with this, Jen and Michelle and the other coaches, right? And you know what? I do want to learn this. I do want to start back at EKG terminology. I want to start back at the waves in the paper. That's where we start you in our 30-day EKG challenge. So don't worry, we actually don't take you from here all the way, right? To just jumping into the deep end of the pond. And Michelle is she's at the farm. She's going to try to log on. But Michelle is actually our coach that is the best at doing the basics. And so she was a nurse for over 32 years. I think it's actually 36, Michelle, isn't it? It's so much, right? And so she takes us all the way back to the basics. But what we're going to do tonight, officially now that we're all here, and welcome in everybody, we're going to do day 5's case, okay? So day 5's case, we're going to talk about the non-specific ST wave changes. Yes, 36. I got it right this time, Michelle. Gary's 32, you're 36. We don't have anybody with any experience in this group, do we? Okay. Also, PS, if you guys are in the 30-day EKG challenge or joining us or considering joining us, I'll be talking a little bit more about that on Sunday. And also, we did confirm Gary's next date for the 30-day challenge. He's going to do 12 leads on August 24th. So just a little note that we haven't updated that schedule yet. Okay, Tori, thank you for dropping the Facebook and Zoom link for us. I appreciate it. But I want to take you back to night 1, where we talked about the basics. Okay, so if you're like, Jen, I'm like so in that basic boat, I want to just go and start at night 1, you can go rewatch it. We have it up for you, right? No problem. And you can watch the basics. We talked about the T waves, the direction matters. We talked about what the normal EKG looks like so that we could build on it and make sure you understand when the findings are abnormal. We also had Gary come on and do a basic arrhythmia review for you guys, right? And he showed a bunch of really cool animations if you got to see that. Unfortunately, it wasn't recorded. Somebody reached out to me today and she was like, oh my gosh, I work nights and what happened to the second lecture on Tuesday? I was like, oh, I'm sorry, sister. Sadly, he doesn't allow us to record, so you have to make it live, and she was bummed, but definitely we'll be having him on again in the 5 days, so don't worry, this is not your last chance to see him. He's a staple in our group. Okay, then we talked about the 2 high-risk conditions in patients that you don't want to miss that are young. So sports physicals, right? We talked about regattas, which is Michelle's favorite, the ski slopes, V1 and V2. We talked about yesterday the HCM patients, the hypertrophic obstructive cardiomyopathy, where you've got the skinny, narrow daggers in 1, AVL, V5, and V6. And then we also talked about the delta wave, right, on night 2 in the Wolff-Parkinson's White. And we also talked a little bit on night 1 about prolonged QT. So even though we only spent 2.5 hours total in this challenge together by the end of it, we actually want to show you that you did cover a lot of ground, but we didn't want to also give you false sense of security. We didn't want you to think you know everything, right? There's still more to learn, including tonight's case, which is going to basically kind of knock your socks off. It really is. It's going to blow your mind. And I want it to, right? I don't want to give it away. So know that we do give the CE, it's 2.5 hours. And there is a post at the very top of the group in the featured part. And it says CE. There's links that you click on. It's a post test and an evaluation, and give us a little time to get your CE back to you. We will email it to you. And again, there's like 14,000 people in this group. There's quite a few. So obviously give us a little lead time. If you haven't heard anything in a couple of days, give us a little nudge. But we do want you to take advantage of this free category 1 CE, right? Because who doesn't want CE for showing up and doing the work? All right, now, case of the night. Let's talk about this. So when I tell you that this is the thing I love teaching about the most, this is because this is a real case. So fun fact, I got to meet one of my heroes in medicine. Maybe some of you know him. His name is Dr. Richard Bucata. And I met him this week. And he actually, I've listened to his MRAP and all the things, right, for forever. And I met him today. He's like, well, tell me about you. Tell me about you. And yes, Tori, you do get 12 hours of category 1 CE in the 30-day. It's totally worth taking advantage of. So he says, tell me about you. And I was like, oh, I teach EKGs. In fact, tonight I'm going to be talking about this 38-year-old female that went to urgent care for a cough. And I said, and it's not what you expected. And I said, and I told him, the fives, like, she came in for this and got sent home with something else. He's like, ooh, that sounds interesting. And I was like, okay, this is pretty cool. Fangirl, he's interested. So anyway, long story short, this is a topic that interests physicians, it interests medics, it interests PAs, NPs, everybody, because we're all seeing people who cough right now. And we all have COVID on the brain. In fact, nowadays, we all have screeners if you're working in an office, right? And they're like, oh, if you're coughing, you're not coming in, right? People don't even get in the door. But otherwise, this was actually way before COVID. So let me just put that spin on it. So we don't have to think about COVID. It's not COVID. It's something else. It's something worse. Believe it or not. I know, I can't believe it. And so this face is the face that I hope none of us ever have to make, right? It's that face of missing the case I'm going to show you. And when I'm telling you about this case, you're going to totally, like I said, you're going to have a reality check, and it's designed so that you don't miss this finding. I'm doing this lovingly. Just keep that in mind. So this 38-year-old female, here, I'm going to let you start scanning it and get the lay of the land, okay? And I want you to start formulating differentials. So this is what we do in the 30-day. Like, I'll put up an EKG and I'll say, okay, give me your differentials for a female 38 cough. Tell me what you'd think about. So guys, type in the chat what you would think about for a 38-year-old female who has a cough. Okay, I know that you'd be thinking about pneumonia, and type in some other diagnoses. Okay, so interact with me. Let me know what's on your mind. Okay, good. Nikki says pulmonary embolus. Oh my gosh, yes. And Nikki, to that note, I would also love to say that, and Sophia and Leslie, oh my gosh, all you ladies are saying PE. I'm so proud of you. And to that note, I would say that there's tachycardia, so you definitely have to think about that. Veronica, yes. And Michelle, I believe that Nuria, who is Magda, is on Zoom with us. So she's already here. And Linda is saying GERD, asthma, COPD. Oh my gosh, Linda, where have you been all my life? Yes, yes. So these are all good too. Allergies, right? More benign. Other things, what else could have cost? I like the GERD one. Smoke inhalation, yes. So these are all good differentials, but I like that you thought the worst first. Now, I'm going to tell you that she did have a CTA, a CAT scan of her lung, and it was not a PE, so we can rule that out. And she's actually still in urgent care. So what could we do for her in urgent care? We could look at her vitals, right? And her sats are fine. Sophia thinks about a D-dimer. Yeah, you could think about a D-dimer. You absolutely could. Jen said some arrhythmias. Nikki said breathing treatment. We could. So let's listen to her lungs. And her lungs are completely stone cold normal. Her sats are stone cold normal. She sounds amazing. What's not normal is actually her lower extremities. So I know what you're thinking. You're thinking, okay, how does her throat look? Oh my gosh, I love that you're saying that. Love it, love it, love it. Okay, so her lower extremities, we're looking for unilateral edema, right? Looking for that. We don't see it, but she does have bilateral lower extremity edema. And I love that you looked at her throat. I love that. I love that, Nikki. Her throat's perfect. Okay. So Jen Henry, oh my gosh, hold that thought, sister, because I like where you're heading with that. Okay, like where you're going with that. So when you look at her EKG, let's look at this together. I want to point one thing out. Bria's in the house. Yay, Bria. I want to point something out to you guys that should scare you from here till the end of time. This non-specific ST T-wave abnormality, if the machine says this, you guys, that is something that is very, very bad. Nobody teaches us this. That is the tragedy, because this is a game changer. There's at least 4 things when it says non-specific ST wave abnormality that are dangerous. And if you rely on the machine to tell you what it is, it's not going to. So at the end of the day, let me show you what I do when it says that. Okay, this is one of the things. Michelle, thank you for tagging Kathy Healy. I really appreciate it. And Kelly's joining us. Yay, Kelly. And hello, Kayla, welcome in. So let's talk about what I do when it says this. Okay, so I do part of our 10-step system. Oh yeah, recap. Remember that 10-step system we learned on day 1? Well, I pull out step, I think it's 5 or 6. Okay, I pull out 5 or 6 and I look at my ST segments, right? Because that's part of it. And I'm scanning the ST segments, looking for any elevation or depression, okay? Now, obviously, I'm doing this with a mouse. It's not perfect. It's not even beautiful, right? But what we are noticing is a pattern of some, and I'm gonna draw this a little bit better for you guys, some pattern of ST depression. Now, this is a little more of an advanced EKG. I will give you that, right? This is not EKG 101. We go to EKG 101 next week, of course, right? We go basic. But I tell you this because if some of you are not joining us in the 30-day, I want you to know this finding because with this, you can save more lives. Now, what this will be described as is non-specific, or actually, sorry, it'll be described as widespread ST depression. And it's widespread depression with elevation, at least one small box, which we do have in AVR, okay? This isn't called anything, but it's widespread depression with 1 millimeter of elevation in AVR, okay? There's a reason why AVR is Michelle's favorite lead. And the take home is that when you have ST depression that spans multiple leads like we did with elevation in AVR, that's the take home, that you don't pass go or collect 200, you don't wait for cardiology outpatient referral, you send to the ER today, because this is a finding that is associated with either a critical LAD occlusion or left main or even multi-vessel. Okay, so let me say that one more time. So if you have widespread depression, and notice this was not very much depression, you guys. So those of you that won our cat window badges, you can use your badge. Those of us that don't have them, you can use pen and paper, but I have to implore you to please use something when you're looking at your ST segments. It's this EKG that is exactly why we do it. Because if it's subtle, we could miss this and send her home. And if she would have got sent home, she would have died. Now, what do you think she came in the clinic and asked for? Because of course she's got a cough. Oh, she's a school teacher, by the way. She also says, I can't walk very fast anymore. I used to be able to chase my toddlers last week and now I can't. So I knew something was wrong. I want that thing that made me better last time I was here. I want that thing that made me better. Yeah, Natoya says she's short of breath. We are not happy with that, right? So we can, the take home is that she's a game changer. She wanted a Z-Pack. That's absolutely right. And Leslie, yes, steroids too. She wanted a Z-Pack. And so I have a little trick that I do share with you in the 30-day about how to not have to prescribe antibiotics to patients and for it not to be your fault. I have a great little talk, but yeah, Sophia, you're right. They always want antibiotics. So this lady came in with a Z-Pack. She's like, I want the Z-Pack. And she went to the hospital and went home with a cabbage. Okay, back the bus up, Jen. Wait a minute. The school teacher who's around sick kids all day, who's coughing, needed a cabbage. Why? Okay, well, let's talk about that. And somebody already got it right. So I'm going to highlight you, you wonderful, wonderful person. I'll talk about that in a second. But really quickly, we send her to the ER, okay? And they do a chest x-ray at urgent care, and they see that she's got what they thought was a pneumonia. So like, yeah, you got to go to the ER. Kelsey, yes. Kelsey, I like where you're going with that. Love it. So we send her to the ER for rule out pneumonia, and she gets a chest x-ray at the hospital read by the hospital radiologist, and they said, yeah, it's a pleural effusion. Well, a pleural effusion was caused by the CHF that Jen correctly picked up on. So way to go, Jen. Everybody applaud Jen. That was really good. And her BNP that they drew was markedly elevated. If you don't know what that is, it's a heart failure lab. It was over 6,000, right? Her troponin was negative and her sugar was up. So she was undiagnosed diabetic. And Nikki, our cheerleader on Zoom, is cheering you on, Jen. So I love that. Thank you, Nikki. You're amazing. So the nuclear stress test that, of course, she's going to get, okay, showed that she had moderate to severe disease in her LAD, and she also had disease that was severe in her RCA. So 2 out of her 3 arteries are completely occluded, and her ejection fraction was 20%. So yes, she was in heart failure because of her multiple occluded arteries. And she had that because she had 2 conditions, right, that she didn't know she had. She had diabetes that was undiagnosed, untreated, which leads to inflammation, which leads to early disease. And the other process that leads to early disease is FH, okay? So familial hyperlipidemia. Yes, also Nikki, she did have a large BMI. She did. And so here she is, right? Thinking she's getting a Z-Pack, get a chest x-ray, go to the ER, and now she's going to the cath lab. And not only did she have a positive stress, she had positive cath, and she did require a bypass. So at her tender age of 38, did she actually survive? Yes, she did. And she actually, as Nikki pointed out, she lost a bunch of weight. She reversed her diabetes, and she actually is doing great now. Thankfully, she's now in a lower impact job where she's actually not chasing after toddlers anymore. And she really turned her life around. Yeah, her heart score is elevated, Kelsey. Yeah. And so she had the familial hyperlipidemia, which was working in the background against her. And she also had the diabetes that was uncontrolled. So, and the obesity. So all of these things, she probably also had sleep apnea as well, but all of these things were working against her to lead to early disease. So the take home on this is, number 1, don't write off your young people. Okay. They can have early disease. I think 38's young. I think 38's young. It is for CAD. It is, right? And so we're not always going to know if they have FH, right? We're not always checking their lipids, especially if they're an urgent or family, right? We're not always checking that. Or the ER, especially, we don't check lipids. So we have to rely more on the EKG findings. So I always, when I have cough, I cast a wide net so I don't get burned. Cast a wide net like you guys did at the very beginning. And you did great. I'm so, so proud of you. And you guys solved the case. So again, if you have the widespread ST depression, that's at least 1 millimeter with 1 millimeter of ST elevation in ABR, that's someone with a severely diseased LAD, and they will most likely need a stent. So when people ask me all the time, they private message me and like, oh my gosh, I'm so nervous. So this is a fun thing. People private message me all the time. It's like a confessional or something. And they're like, I just feel so ashamed. I should know more about EKGs, but I don't. And I just never know what to send to the ER. I never know when to pull the trigger. So that's actually something that we walk through in the 30-day if you guys are joining us, because that is kind of a complicated thing. But this is one of them that I would say, yes, send them to the ER. She was not on OCP. She wasn't, but good thought. Definitely a good thought. So if you want to know, so let me flash back for a second. We're almost done for the night, but I wanted to give you this list because flashback to yes, that was a scary EKG, right? But flashback to, I was a baby paramedic, and one day it hit me that we have to, that I had to as a medic. There was nobody else on scene. We didn't have cell phones then. Yes, I'm old, but we didn't have a way to communicate with the hospital. I had to figure it out, right? I had to figure it out, and I had to always know the findings. So that hit me one day, like, oh my gosh, what if somebody wants to AMA and they have something that could kill them and I don't pick it up if I'm the only one? And that's the case with us who are as PAs, NPs, or medics, right? We don't always have somebody else to ask. So we have to know these findings. So what I did was I got scared. And the fear is what makes you safe. The fear is what sat my butt down. And I was like, okay, I'm gonna make a list. This was the list of the things that I thought of that could kill somebody if I missed them. And then I memorized those findings, because here's the nugget of the whole challenge to wrap it up with a beautiful bow, okay? The nugget is really, you don't have to know, as Gary said, everything about EKGs. You don't. What you have to know is the things that you can't miss, the things that will kill somebody, and the things that the machine will miss. Know those things, and what you know about them is you learn their patterns. And once you got their patterns in their mind, right, then you can pick them up. That's why, going back to night 1, the normal ECG is so important. So then you know what abnormal is. That's why flashback to night 3 and 4, the 2 things that kill young people are at the top of this list. And guess what? You've already started learning these things. You learned that ski slopes in V1 and V2 are bad. You learned that skinny narrow daggers in lead 1, AVL, V5, and V6 are bad, hokum, right? So there's other things on this list clearly, but knowing these things will get you very, very far. And if I literally could take my younger self, I wouldn't have taught my younger self axis for the first part of EKG. Like literally, I almost ran out of the door. I was like, I'm a smart girl, but I don't understand this. That was like the first thing they taught us about EKGs. If you want to scare somebody, do that, right? What I wish I could have told my younger self is, Jen, just go home and learn the high risk patterns and the flipped P wave. No one's going to die from that, okay? And PVC, you could miss that. Like, I'm not recommending you do that, but I'm just saying that our priorities are so wrong and we get caught up in the weeds, right? Get caught up in the weeds. So learn these things. This is where you spend your time, your precious time. And that's why I'm so grateful that you spent the last 5 nights with us to invest in yourself, to invest in your patient, and ultimately your patient has better outcome because of you. So that is my hats off to you. Now, if you want help learning these findings, of course, we'll show those to you, right? And I'll tell you a little bit more about the 30-day in a second. But if you got everything you needed from this challenge, if you're like, Jen, I'm good to go, I just needed a quick, tune up on my high risk, then I want to thank you for your time. And I want to thank you for rocking with us. And I know a lot of you come back time after time. And I know your names now. I see you and I appreciate you. But if you want to learn a little bit more about how to continue on the great momentum that you gained in the last week, we start Monday. And I'm going to tell you a little bit about it. And then I'm going to come back on and do the drawing for the tutoring with me in a small group for Sunday. So if you want to learn in a small group with me on Sunday and you're free, at 5 o'clock PST, which would be 8 o'clock EST, right? Then, then join, then try to enter the drawing, which I'll give you the hashtag in a minute. Leslie, I know, and you're in our 30-day, so you're going to learn the basics. We're starting with basics on Monday all over again. So you're good. Okay, so we'll be doing the giveaway, as I mentioned, but really quickly, the 30-day EKG challenge, I want to just tell you that we call it the 30-day because in 30 days, we get you all the classes that you need to start feeling confident. Yeah, Sarah, you're so welcome, right? We give you all the classes that you need. Here's a picture of Michelle. She actually breaks down the coronary arteries and the contiguous leads for you. This is a couple other of our coaches you haven't met yet, but these are both Sean and David, EKG masters. And of course, we have lots of people that we bring in for you to have exposure to. So it's not just one person talking all the time. And we basically take you through this pathway of feeling scared and hating EKGs to giving you a hybrid program where you have access to recorded and live interaction, and we have 6-month access to it. So yes, we do everything in 30 days for the core program, but you have 6-month access. And if you miss something and you want to catch it live, you just come the next time, which is so fun. And these are all of the coaches that we have to give you access to. In fact, so Sunday, and for our current 30-day members, we're doing something called a Lipid Workshop, where Coach Whitney's going to come in and talk about lipids. Tuesday, we have our coach, Carissa, coming to talk about sleep apnea. Yes, Munya, I know you have one with Michelle, so she'll definitely get you the link for that. And we have all sorts of other wonderful people, including Coach Megan and Coach Michelle. So Coach Megan is our cardio NP, and she does all the cardiology, like inpatient, outpatient topics, like stress testing, heart failure guidelines, chest pain guidelines. And then I walk through how to document and keep you safe, how to do a differential, how to work up a patient, and all the EKG stuff in between. But just to kind of give you a taste of what's coming just for the first basically week, we've got the welcome call on Monday where we do what to expect, and then we do a little EKG terminology just to get your feet wet. And then the next on Wednesday, we do the basic arrhythmia class. And then we do sleep apnea on Tuesday with Carissa, who's the sleep NP. We have a study hall with David where you can put your EKGs in. And I want you guys all to take advantage of this. When you get to join the 30-day, if you have EKGs that you're stewing on, put them, take the names off, put them in the 30-day group and tag David, and he will put them in his study hall and break them down for you. He's the most brilliant EKG person I know, and I say that without any hesitation. There's some doctors that are around. There's nobody smarter than him. And if you guys are in our 30-day, you know that. We have lipids with Whitney, and then we also have basic 12 leads with me on Monday the 8th. So this is all just in like a week's period, right? So we have a lot of really good things you can choose from. You don't have to come to all of it. It's all recorded. But you pick and choose. You're like, ooh, I want to learn XYZ, right? And the CEs are all based on 12 hours, are all based on the recorded classes, which is good. So you get sent out, like Tori mentioned, an RCAT window, get your workbook sent out that we don't even use till the 20th. So you got plenty of time. Even if you decide, a lot of people decide like Monday, I'm going to join, and they join at the last minute, it's fine. You'll still get your workbook in time that we go over on our hands-on workshop. So you get all these wonderful, like previously recorded classes, right? Everything we've done for the past 2 years. And you get to do the hands-on live workshop with me for 3 hours where we give you a lot of info. In fact, I just did this class for an ER group around the country, a virtual class. And I put the reviews in our 5-day EKG challenge today. They were like, I can't believe how much I learned in 3 hours. You can too. It'll be the same class. And you also could get access to all the scary things that we put on that little scary list. We do all those scary things in 3 hours. So you will walk away feeling super confident. You get access to 2 Facebook groups, which is kind of cool. Access to our July 30-day EKG. We have all of our 2 years of stuff that we've been recording, right? And all the live lectures are here. But we do have something called the EKG Launchpad that's available for people who are beginners. And you can jump into that and you can actually just do the basics, right? So Michelle is doing stuff like, let's color the coronary arteries. Let's talk about the waves and the paper. And, how big is a Q wave that's pathologic? Let's talk about, inferior wall STEMI, posterior STEMI, like all the things. That all happens in the Launchpad. So you get access to both. And you get one of these kits mailed out to you, to your house, and you get to keep it. Okay. So again, we have our lipid queen, our sleep apnea queen. There's just so many coaches that you'll have access to, which I love. I love to brag on them. And the prices are really reasonable. So if you want CE, then you're going to choose one of these, right? So if you're EMS, it's only $149 for the whole 6 months. If you're RN, it's only $199 for the whole 6 months. And if you're an NP or PA and you want CE, it's $249. And that includes everything being sent to you in the mail, right? And the student is for anybody who doesn't need CE. You can join us that way. And thank you for posting the link, Tori, in both Facebook and Zoom to join us. If you're the student and you don't need CE, you can join us this way. And you still get access to everything. You get the kit, you get all the classes, you get access to both groups, all the recordings for 2 years, and you get your learning portal forever. So this is a smoking hot deal. It's not going to stay at this price after the summer. We did this as summer pricing only, but we want you to be able to take advantage of it. And the great thing is that our students that are in the group, and Michelle is echoing this, they are kind of like the 5-day group, but more close-knit. In fact, we do live events for our 30-day people, and we do, like, next year we're gonna have a barbecue in San Antonio. So we're kind of a family. It's pretty great. We're all supportive. There's no dumb questions. We love having new people and people that just want to learn, right? So there's no judgment ever. So with that being said, if you have any questions, reach out to me. I will be happy to answer them. So will Michelle. And we'll be back. If you're in Michelle's special tutoring that you won over this week, you'll be back tomorrow with Michelle in a private Zoom. If you're going to be entered to win tonight for my tutoring on Sunday, you have to be available Sunday at 5 o'clock Pacific Standard. Don't enter unless you're available. I'm going to be picking tonight. I'm actually going to hop off, go check on my dad and my stepmom because I'm at their house right now. And then I'll be doing the drawing live. Okay, so I'll announce the winners and then I'll make sure to get you the Zoom for the special meeting with me if you are a winner. Okay, so as Esprit said, the best barbecue. Yes, Michelle actually barbecues. Michelle, are you here on Zoom with us? Because I would love for you to say hi if you want to. If not, no worries. And the hashtag to be entered to win. So you guys, hashtag enter to win. The hashtag is hashtag Jen. So easy, right? And yes, as Tori said, we will see you on Sunday. We will see you on Sunday for the bonus session at, I have to look up the time again, I'm blanking, but the bonus session on Sunday, and then we'll have the tutoring session. So that's coming up on Sunday. I'll have Ruben post a link. So I got your names here. Magda/Nuria, can you also post in the Facebook group your hashtag? Because I'm going to hop off and come back on to do the drawing. I'm not going to come on Zoom though. I'm just going to be in the Facebook live. So I want to make sure to get all of your names. So Tracy, Linda, and Nikki. So I'll see you guys back for the drawing in just a few. Just got to go check on my dad, and I'll see you soon. All right.